Did you know that diabetic foot infections can be caused by several microorganisms, including gram-positives and gram-negatives, and it can require amputation? Hi everyone, I'm Professor Germán Esparza, specializing in clinical microbiology and antimicrobial agents at Pontificia Universidad Javeriana in Bogotá, Colombia. Welcome to this episode of Lab Knowledge series called Mastering Antibiotic Resistance Challenges. This series is presented in collaboration with the Lab Knowledge Institute. Today's episode is about diabetic foot infections. I hope you enjoy it. Let's start with the case. This is a 61-year-old female patient diagnosed with type 2 diabetes 14 years ago. This diagnosis included also sensitive and motor peripheral neuropathy, metatarsophalangeal arthropathy with no signs of osteomyelitis, and diabetic arthropathy. The patient had presented ulcers in both her feet for 10 years now, in the metatarsophalangeal area. This had been never completely healed in this period. She did not present partial nor total amputations. She had needed several admissions in hospital due to recurrent infections and had needed debridement and IV antibiotics on multiple occasions. Amputation had been suggested before, but she had always refused it. In the culture, carbapenem-resistant Klebpneumo was recovered. What samples are used for the diagnosis of diabetic foot infections? The preferred sample is biopsy because it guarantees that microorganisms are recovered from the deep tissue, and remember that this infection can also compromise bone. Samples should be sent in a proper container, preserving moisture, and should be macerated before culture. Appropriate media including blood agar, chocolate agar, McConaughey agar, and liquid media may be used. Anaerobic culture is not usually performed unless it's specifically required by clinicians. What about ulcer swabs? The problem using swabs is that bacterial growth can only represent superficial flora, and we may not obtain reliable results. So, if you want to use swabs, take into account that cleaning the wounds is really important beside a good quality swab. Cotton tip swabs are not recommended to collect samples anymore. How should we deal with the carbapenem-resistant gram-negative rat? First things first, what is the species? Remember that in some pathogens like Proteus, Morganella, and Providentia, imipenem resistance is usual. Additionally, as was mentioned in other episodes, Pseudomonas aeruginosa may develop resistance to carbapenems using efflux pumps, porin mutations. In the case of Enterobacterales like Klebsiella pneumoniae, carbapenem resistance can be caused by carbapenemases themselves. Carbapenemase detection is very important to prescribe appropriate therapy. You may use several options like the rapid carba-MP method, which can be used to demonstrate that carbapenem resistance is mediated by a real carbapenemase enzyme. But you need to use additional testing. For example, PCR methods to identify the specific enzyme like NDM, KPC, VIM, IMPs, or OXA48s. Immunoassays may also work and be cheaper, but they are limited to the number of variants included in the test. Inhibitor-based tests are other alternatives. However, sometimes are difficult to interpret. Patients with carbapenemase-producing organisms should be placed in contact precautions to avoid outbreaks and dissemination of this mechanism to other organisms. What drugs should we test when encountering a carbamase producer? You should include meropenem, tigecycline, aminoglycosides like amikacin or tobramycin, trimethoprim sulfa, fluoroquinolones like Cipro or Levo, and if available in your country, new inhibitors like ceftazidime avibactam, which could be combined with aztreonam for the metallocarbapenemase producers. Let's go back to our case. This Klebsiella pneumoniae was a KPC producer, so ceftazidime avibactam was prescribed and combined with tigecycline for anaerobic coverage. Patient received 7 days of IV treatment and then was switched to oral doxycycline, which was susceptible also in the report. Remember, biopsy is the preferred sample for diabetic foot infections or other deep tissue infections. Carbapenemase detection is important for therapeutic and infection control purposes. Thank you for joining us on this episode of Mastering Antibiotic Resistance Challenges. Do not forget to like this video, click on the subscription button and hit the bell to receive a notification for our next video. Together, we can make a difference in the fight to preserve antibiotic efficacy. See you next time.